Good afternoon. Thank you all for being here. Sorry I was running a few minutes late, and as I mentioned to our folks, originally apparently this event was supposed to take place. We wanted it out in the community and out. Let me thank a couple folks. We have an exciting announcement to make this afternoon. Although I kind of get the impression that most of you actually already know what I'm going to say. Our great DHS Commissioner, Ambrose, I want to thank you, and of course CEO Terrence McSherry of the Northeast Treatment Center, also known as NET, Nilda Ruiz, President and CEO of APM, Carol Tracy, excuse me, who's a member of the DHS Community Oversight Board, and we have our two captains here. We want to recognize all of those folks. Please recognize these great folks here. And to all of you, thank you for coming out. Once again, I do really want to give special thanks and appreciation to Commissioner Ambrose and her entire team, hard work and dedication, the children and families of our great city. She and the entire DHS team have made it their goal that we will be a safer city, a more efficient and more productive agency, and while remaining committed, of course, to the interests of Philadelphia's families and children. And let me assure you that is a tremendously tough job. Excuse me. When I asked Anne-Marie to come on board with us, and it was one of my happier days in public service, and as mayor when she said yes, I asked that we systematically change how this agency functions and operates, and that we had to have a complete review of all of our policies and practices, and that we need to think about how do we deliver services in a very different fashion, how do we ensure greatest extent possible that our children and our families are not only safe, they can stay together, they can live in partnership and harmony in this city. And this is some of the toughest, most complicated work, and I think that it is more than appropriate, and I've said this on a couple occasions, I'm hoping that someone might actually pick this up today, that while I recognize, of course, our two police captains, they of course are instantly recognized as first responders and public safety officers. The men and women of the Department of Human Services are in the public safety business also. They need to be recognized for that. They are first responders. Because in many instances, they're the ones who are also out at 2 o'clock in the afternoon, but sometimes, based on a call, they might also be out at 2 o'clock in the morning. And as these fine gentlemen and our other police officers who are here are trained up at the police academy, and we give them certain tools and certain equipment, they have a badge, they have a firearm, they have other devices to protect themselves. Our social workers, our DHS workers, are armed with maybe their city ID and the love and the passion of children and families in their heart. That's it. And they go in some of the toughest neighborhoods in the city of Philadelphia, not in the blue and white, not with all the backup and support at times that they might need, just trying to do their jobs. And they need to be recognized as the great public servants and public safety officers that they are as well. In the last 5 years, the Department of Human Services has made tremendous strides, tremendous strides. The number of children placed in homes outside their family has decreased by 35%. That means, of course, that more kids are finding permanent homes within their own families. The number of children moved from placement to permanent homes has increased from 34% to 50%. The percentage of children in DHS's care for more than 5 years has decreased from about 12% to less than 3%. And in April, I signed the DHS SVU co-location bill, which will finally, after decades of people talking about it and wanting it to happen and studying it and looking at it and talking about it, we're actually going to do it. And that's going to bring children, advocates, and PCA and DHS workers and members of the Philadelphia Police Department Special Victims Unit, and representatives from the District Attorney's Office, all together to better serve the interests of children who are victims of sexual abuse. But no matter how many improvements we've made over the last 5 years, let me assure you that we can, we will, we must continue to do more. Today, I am very excited to announce another opportunity for our administration and the Department of Human Services to put the welfare of Philadelphia's children first where it belongs. We will begin implementing the shift to the Improving Outcomes for Children program. This process will streamline the DHS case management system into a single case management system. For all of you, of course, the government would almost stop operating if we did not have a full array of acronyms and new acronyms, because everything we do is based on an acronym. We couldn't run the government if we didn't have acronyms. This will be known as IOC. I have another one for you in a second. Simply put, under the current system, we've known this for some time, there are many overlapping duties and responsibilities. The potential for confusion and the reality of inefficiency is a fact. The new system will shift all case management services to selected service providers called Community Umbrella Agencies, CUAs, or also now known as CUAs. There will be a legend given out at the end of this presentation for the other 15 or so acronyms that we have just for DHS. Community umbrella agencies will be chosen by DHS. These are already service providers who are working with our agencies in their respective communities. DHS will identify 10 CUAs from neighborhoods all across the city of Philadelphia. CUAs will provide proper case management services and will subcontract with specialized service providers in the same community as the CUA. Today we're announcing our first 2 community umbrella agencies, APM and NET. Both of these agencies, as many of you well know, are located in eastern North Philadelphia, an area that unfortunately has a rather high case rate. Let me be clear, that there be no confusion. The Department of Human Services in the City of Philadelphia will still ultimately be responsible for the children in our care. DHS employees who formerly served as caseworkers will take on new roles, new duties, new responsibilities. They will provide training, and they will oversee, monitor, and perform quality control and the practices that are necessary for this work of the community umbrella services, again, umbrella agencies, again, also known as CUAs. DHS will continue to operate their hotline, continue to perform intake, and will still conduct investigations. Families will now have the expertise of DHS staff and will still benefit. We will still use that staff to benefit these community organizations with their experience and their relationships, their proximity, and their knowledge. This shift, of course, is any massive change in a large system. It will not take place overnight. It will take some time. We will select the remaining 8 agencies, train them, and move case management services over to them over the course of the next few years. Before I turn things over to Commissioner Anne-Marie Ambrose, I want to point out that this shift comes with the support and endorsement of many of our DHS partners. We've been working on this plan for a long time, pretty much from the time that Commissioner Ambrose came into our service here in Philadelphia. As I mentioned before, it's a very large system. The Department of Human Services, all funds in, believe, spends a budget that is actually greater than the police department. They have an enormous staff. They deal with folks who have significant challenges. And if people would stop doing some of the things that they're doing, we wouldn't have a Department of Human Services in the first place. And so when we have to take action, when we have to show up at somebody's house, when we have to, at times, remove someone for their own safety, parents and caregivers would stop doing some of the things that I know, unfortunately, they do, because I read the reports that I get. we would not have much of the mayhem and disorder going on in our city and certainly in our families. This effort is all about reducing confusion. It's about stopping the finger pointing. We're all partners in this work, and we must make this system work for our children and for our families. And so it is with great anticipation and great honor. The Commissioner and her staff have been talking with me about this for more than a few years. And so it's always a pleasure when these ideas and these great proposals and the well thought out work of experts in their field come to fruition. And so please join me in giving a very warm, although it will be anyway, welcome to our great Commissioner of the Department of Human Services, a first responder, a public safety agency. And she's going to talk a little bit more about the IOC coming to fruition, our great Commissioner, Anne-Marie Ambrose.
So this is really an exciting day for DHS and for the child welfare system in Philadelphia. And the mayor talked about a couple of people, but when I look around the room, I don't think we expected that many folks to come, but when I see you all out there, we had over 150 different stakeholders who have helped us with the planning for improving outcomes for children over the last 2 years, but we've been planning for about 4 years. I just got a surprise visit from Zainab Shaheen from Casey Family Programs. I could cry, but the mayor hates when I do that because she was here with me
because
from the very...
when you start crying, then I start crying.
Yeah, right. Zainab was at my announcement when I was announced as the DHS Commissioner, and they have been an amazing partner to the Department of Human Services throughout all of our transformation efforts, and we truly appreciate your support. The provider community that is well represented here, who've been really part of the planning efforts. We are partners in this work together. We're all in this together, as the mayor said. We have to be really working on these cases hand in glove from the very beginning, and so your presence here is very meaningful to us and very important as we move forward. The state, so Rahima Shamsuddin Hamden, the staff from the Office of Children, Youth and Families, their partnership has been terrific. They're fully supportive of IOC, and we really look forward to how this can improve the lives of our kids and families. The mayor talked about the amazing DHS leadership and the DHS staff who've been involved in this, the union leadership who's been on our stakeholder committee. All of this has been a joint effort because we all know that we can and will do better for the children in Philadelphia. So I'm incredibly honored to be here with all of you today. And as we move forward, the work is going to continue to be hard. But if we're all working on these efforts together, the system can't help but be improved and outcomes for children improved at the same time. So I'm really excited about being at the end of what was a very exhaustive process. I think the providers would agree with me that we spend a tremendous amount of time really researching this and making sure that we had the very best providers who have roots in the community. This is about accountability first and foremost and providing clarity around what's going to happen with children and families, but it's also about working with communities. As the mayor said, our staff are can only go into houses when we get called in. We're not there 24/7. We don't know what's happening. Community members have a voice. Community members have a responsibility in helping be the first line of defense to prevent abuse and neglect. And so we're really excited about the roots that APM has in the community, incredibly impressed by the work that they've done over 40 years, not only in social services, but on economic development, the things that they can do in communities that eventually will have an impact on children. And so we're incredibly excited to partner with Nilda and her amazing team of staff, many of whom are here today, and also NET. We have a long-standing relationship with NET. Their tentacles and their continuum of care really addresses the issues that our families see on a day-to-day basis. Drug and alcohol, behavioral health. They have the continuum of services that's going to be necessary to really work with the communities and work with families in a way that hopefully really provides more safety and more well-being for those kids and families. And so we're just very excited. This is the first step in a planning process that's taken over 3 years. We have a lot of work to do, but we're incredibly excited about the opportunities and how the system can improve based on all of our collective work together. So I'd like to invite Nilda Ruiz up. APM has been selected to be the ACUA for the 24th and 26th Police District, and we're really, really excited about the partnership.
The mayor is always teasing me about thanking everyone that goes by, so I told him I promise I won't make it a long list. Thank you so much. We are so thrilled. I think that Captain Cram, we've been working for the last 2 years on the Sustainable Communities Initiative. He's been very, very, very involved, and it's great to have police officers like that that work with you on a community basis, and not after the crime is done, but will work with you to try to improve those. And we have a quality of life plan that we've put together with the community, very, very involved. And he's been through that, and I've just gotten to meet Captain Vol, and he seems to be of the same philosophy, so I know we're going to be in really good hands. We're just so excited. I think a lot of people know us from our community development realm, but I don't think they realize that 80% of the work that APM does is around children, and our whole philosophy is children-based. We believe that families and children thrive in healthy environments. And everything, if you look at our mission, you look at our vision going forward, it's all about that. How do we provide healthy environments for our families and our children? And by doing that, we have better neighborhoods by providing assets and growing assets not only within our families, but also in our neighborhoods, so that once that neighborhood grows, then the city becomes better. And that, we call it our internal theory of change that is all around the families that we serve. We're really humbled because this was not an easy competition. We had some tough competition, and I see some of them here, and they're great. So we feel very humbled and honored, but we're going to do the best, and we're going to reduce those numbers even further, and hopefully one day not one child from our community will be displaced. But I don't know if that's too much of a lofty goal, but it's not an overnight kind of thing. It's going to take a while, but I know that I have the best staff. They're committed, they're passionate, and we were birthed from this community, and it is our interest to make sure that our children are safe. They're our #1 concern. So we're really looking forward to working with DHS. With the APM staff, Dr. Pope is going to be leading this. Dr. Pope, would you stand? She has been the big impetus behind this and will be leading this effort. So if you have questions and and Jennifer Rodriguez is the one that runs our community engagement. I think I saw her in the back.
All the way in the back.
She's hiding.
Oh, wait.
Are you hiding? She's the one with the hand up there. With the rest of the APM staff, our VP of Community Development is back there, our CFO, so anyway, all the ones. Thank you all, because we have a big job ahead of us, but we're up to it, and we're ready. Thank you.
I'm Terrence McSherry. I'm the CEO and president of Northeast Treatment Centers, and we are very honored to have this opportunity to partner with DHS, the other city departments, with APM, and our community partner agencies. But I want to actually address my remarks more directly to the families who are in the Franklinville, Fairhill, Hartranft, Fultonville, Hunting Park, and parts of Kensington who are affected most directly by the CUA that we are going to be leading. Many of you may be familiar with Northeast Treatment Centers or NET, so you know the quality of the recovery support services that we've been providing for many years. But what you might not know is that our success is largely due to the fact that we have for many years hired peer specialists, recovery specialists, who are themselves part of the community, who are themselves in recovery, and who can help other people who are just entering treatment and to help them sustain their recovery over time. Making sure we hear and understand the voice of the people we seek to serve was so important to us that years ago we also started to employ parent support folks. who have been people who at one time need a little extra support, come from the community again, and they had some problems with their children, and we wanted to make sure that we took advantage of their experience as we moved forward and they moved forward. And more recently, we extended this idea to the point where we have a youth leadership council. These are people, this is the voice of young people, and they can't get lost in this process. It's too easily to happen that the adults start taking over what's going on. We think that the voice of the young folks has a great place. All the people in these positions help to shape and guide how we provide services. And I share all of this with you simply to say that we are just as committed to making sure that the voice of families in these areas is heard, that we come to fully understand your needs and the dreams you have for your children. There'll be many opportunities to speak with you directly as we develop this and as we implement further, but we want to make sure that as we're going through this new partnership that you understand who we are and where we're coming from.
Series of recommendations, over 30 recommendations, to improve the performance of the Department of Human Services. Some of them were relatively easy to implement, some were more challenging, but none was more challenging than the recommendation to clarify the roles between DHS and its provider community. And thank you, Mayor. DHS undertook this probably with more thoroughness than anything else and more analysis. They did exhaustive research, looking at how other communities handle this, and most importantly, engage the community, engage the whole range of stakeholders that interact with DHS. So our role, of course, is to monitor DHS performance, and this is a very important and may be the final recommendation that requires implementation. And we're really very excited about it. We're very excited about the process that DHS undertook, its connection, and its demonstration of understanding that they cannot be anything if they are not in full and complete partnership with the community, with the individual families and with the providers. So we congratulate Annie, we really do, and we appreciate always the support that our mayor gives to this. There are very few mayors in the United States who invest as much in child welfare as Mayor Nutter does, and we really appreciate that and like to take the opportunity to
Okay, I didn't know that she was going to say that, but Kara, thank you very, very much, and to both of our new providers. We're partners in this. We're all together in this work. It's not go off and do what you do and kind of good luck. This is about a true partnership. We'll always be by your side, near you, around you, supporting, pushing and pulling to ensure that change is real, change is sustained, and it is long-lasting. And so there really is nothing more important to me than our children and our families, because that's what makes a city a city. So thank you, and let's congratulate our providers one more time. If there are any questions from the news media about today's announcement, this particular announcement, we'll be glad to try to answer any of those questions, or someone will. Yeah.
I guess, short in terms as possible here, how is this better than the status quo? Why is this better? What would be the better outcome?
So there have been, and Carol might join me and chime in here, but there have been reports for the last 15 years about the dual case management structure at the Department of Human Services and the fact that it contributes to a lack of efficiency and accountability. Children and families now have 2 case managers, and sometimes they don't know who they should answer to. It creates cracks in the system, and so the Danielle Kelly case was the best example of this. So remember, we had workers who were paid by the department who were supposed to be visiting Danielle and her family. We had DHS workers who were supposed to be visiting Danielle and her family. And what I've come to say is that when everybody's responsible, nobody's responsible, because you can blame the other person because there's a lack of clarity around the lines of responsibility. This is an effort to clear up that lack of clarity and to be very, very purposeful in who's supposed to do what so that children and families get what they need and children don't fall through the cracks.
And I think the CUAs, the CUAs will replace DHS oversight, is that right?
So we currently have providers doing direct service. When that was implemented about 15 or 20 years ago, we just never redefined what the DHS staff were supposed to do. And so this is taking that final step and pulling DHS out of case management for cases that are accepted for service and saying very clearly and directly, provider agency, you're responsible for providing direct services for this child and this family.
So the buck stops at the CUA.
It does, but as the mayor said, DHS isn't abdicating any responsibility here. We're still ultimately responsible for the welfare of children under our care. We're just doing it in partnership and really delegating that role very clearly to the private provider.
And since DHS is being taken out of that equation, is there going to be a reduction in force at the DHS level?
No, we actually have committed to having no layoffs as a result of this plan. The DHS staff we've created new roles for them. Some of those roles will relate to practice specialists and how we check in at critical points in the life of a case to make sure that things are going smoothly. We'll be facilitating a teaming process that is really led by the family. And then we've created a division of performance management and accountability that's been in place for about 3 years. Has a lot of quality assurance and quality improvement functions. Those functions will be enhanced so that we'll be providing monitoring, technical assistance, and support for the CUAs when we identify problems.
So the budgetary impact of this move is?
It's a budget neutral initiative. We're very hopeful that in working with our partners, we'll be able to maintain the current status quo with the budget. Mary? So right now we haven't finalized. We're going to be in a negotiation phase with the CUAs as we move forward. But when we calculate the approximate costs, it's about $10 million for one of the CUAs and about $15 million for the other. And the way we've calculated those costs are based on caseload sizes and staffing, as well as current services that are delivered in the 2 CUAs that we looked at. So with the support of Casey Family Programs, we hired public financial management to do some financial analysis, and we did some work in calculating through the costs and coming up with those projections. But we haven't finalized the budgets with the CUAs. We have about a 6-month period of time where we'll be sitting down and working really closely with the leadership of the agencies and working through those costs.
And that's over a period of time, and then does that come out of the operating budget, or?
Our budget is a mix of federal, state, and local. It's a complicated budget process, but the state has been incredibly helpful in working through some of those issues with us. And so this has been an area of great concern and great focus for us, and so we spent a lot of time working through the financial pieces of this.
Okay, fantastic. For those of you who brought your trunks, the pool is open, and you should enjoy the rest of the afternoon. Take care. Bye bye. Thank you. Thanks for being out.